What if I told you that a tiny insect, no bigger than a penny, could silently spread a disease that may damage your heart and digestive system? The CDC has confirmed that kissing bug disease, also known as Chagas disease, is now endemic in parts of the United States. But what exactly is it? How do people get infected? And how can you protect yourself and your loved ones? In this video, we'll break it all down step by step. Kissing bugs are blood-sucking insects, officially called triatomine bugs. They get their nickname because they often bite humans near the mouth or eyes while we sleep. Unlike mosquitoes, these bugs don't spread disease through their bite itself. Instead, the danger comes from their droppings. If you accidentally rub the bug's waste into your eyes, mouth, or even an open cut, the parasite they carry can enter your bloodstream. That parasite is called Trypanosoma cruzi, and it's the real culprit behind Chagas disease. Chagas disease is a parasitic infection that can be silent for years. At first, the symptoms may look like the flu, fever, body aches, and fatigue. Some people develop swelling around the eye where the bug's droppings entered. But here's the scary part. In the long run, Chagas can cause serious, even life-threatening complications. It may enlarge the heart, cause dangerous arrhythmias, lead to heart failure, or create severe digestive issues. The World Health Organization considers it one of the most neglected tropical diseases, and until recently, many Americans thought it was only a problem in Central and South America. That has now changed. The CDC now reports that kissing bug disease is endemic in the United States. That means local transmission is happening here, not just from travelers returning from abroad. The bugs are most common in the southern half of the country, Texas, Arizona, New Mexico, Louisiana, and even as far east as Virginia. And while the number of cases in the U.S. is still lower than in Latin America, doctors are concerned because the disease is often underdiagnosed and untreated. Transmission usually happens at night. The kissing bug bites, feeds, then leaves waste on the skin. If you scratch the bite or touch your face, the parasite can slip inside. In rare cases, Chagas disease can also spread from blood transfusions, organ transplants, or from mother to baby during pregnancy. It's not spread by casual contact, like shaking hands, hugging, or sharing food. Knowing the exact pathway of infection is key because it means prevention is absolutely possible with the right steps. Chagas disease develops in two phases. The first is the acute phase, which can last weeks or months. Symptoms may include fever, body aches, swollen glands, rash, or swelling around one eye. Because these look so much like common illnesses, most people never realize they've been infected. The second is the chronic phase, which may take years to appear. About 20 to 30% of people develop serious problems, like enlarged heart, irregular heartbeat, sudden cardiac arrest, or digestive issues, such as difficulty swallowing and severe constipation. The fact that it can remain silent for so long makes early detection critical. In Latin America, millions of people live with Chagas disease. In the U.S., experts estimate about 300,000 people are currently infected. Most of these cases are linked to immigration from regions where the disease is more common. But the CDC has confirmed local cases caused by kissing bugs here. Because many Americans and even some doctors don't recognize the symptoms, Chagas often goes undiagnosed. This silent spread is why the CDC now lists the disease as an emerging public health issue for our country. Diagnosing Chagas disease requires a blood test to detect antibodies or the parasite itself. If caught early, treatment is available. Two main medications, benznidazole and nifurtimox, can kill the parasite, especially in the acute phase. Treatment is less effective once the disease becomes chronic, but it can still help slow progression and reduce complications. The challenge is that very few doctors in the U.S. are familiar with the condition, which means patients may go years without the right test. If you live in or travel to areas where kissing bugs are common, and you experience unusual symptoms, talk to your healthcare provider. Prevention is the best defense. Kissing bugs are attracted to light and may enter homes through cracks, gaps, or poorly sealed doors and windows. To reduce your risk, number 1, keep outdoor lights away from sleeping areas. Number 2, seal gaps around roofs, walls, windows, and doors. Number 3, use screens on windows and doors. Number 4, keep pets indoors at night, as kissing bugs often feed on dogs. Clean up piles of wood, brush, or rock near the house, since these are common hiding places. Simple precautions like these can greatly reduce your chances of encountering the insect and the parasite it carries. Anyone can technically get Chagas disease, but certain groups are more at risk. People living in rural areas of the southern United States, especially in homes with open walls or
Oh,
unsealed
what a
roofs, are more likely to
lovely
encounter kissing bugs. Outdoor
day.
workers and pet owners also face higher
Almost
exposure.
done
Babies
for
born to infected mothers can contract the
today.
disease during pregnancy. Because
Sleep
complications are
tight,
most
my
dangerous for
little
older adults
one.
and people with weakened immune systems, awareness in these groups is especially important. Globally, Chagas disease affects an estimated 6 to 7 million people, mostly in Latin America. But as kissing bugs adapt to new environments and as climate changes expand their habitat, the U.S. faces growing risk. Public health experts stress that the sooner we raise awareness, the more lives we can save. Recognizing the signs and preventing contact with these insects is our strongest line of defense. Kissing bug disease may sound frightening, but knowledge is power. Now you know what it is, how it spreads, and how to protect yourself. If you live in or travel to areas where kissing bugs are found, stay alert, seal your home, and seek medical advice if you notice unusual symptoms. By spreading awareness, we can keep our families and communities safer. Don't forget to like this video, share with others, and also subscribe our channel for more clear, science-based health updates.